Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about symptoms of childhood bipolar disorder or pediatric bipolar disorder or juvenile bipolar disorder. This disorder has gained ground in the last 2 decades. Though it's difficult to differentiate bipolar symptoms from, typical tantrums of childhood or even from ADHD, there are some signs, one of them being intense and prolonged tantrums. These are particularly important and pressured speech with too many ideas. These are red flags which may say that there may be childhood bipolar in the mix. Bipolar by its very name is mood swings. So there are high moods and low moods, so manic and depression. Now, childhood bipolar is different from adult bipolar. So even though the DSM-5 has not given childhood bipolar disorder a separate diagnosis, it is very different from the adult bipolar. In what ways? That it is very rapidly cycling. So there aren't any discrete periods of manic behavior and discrete periods of depressive behavior that you see in adults. In fact, these children can have rapid cycling through the day of energy and mood swings. In fact, they behave more like bipolar disorder not otherwise specified. So bipolar and NOS. So what happens in the high moods? The child may have explosive and protracted temper tantrums. They cannot tolerate frustration. They have a low frustration tolerance. So small or trivial things and sometimes no reason, they start becoming upset and angry and have an outburst. They often have oppositional behaviors, and other times they are silly, goofy, excitable. This is also part of their manic behavior, and that's why they resemble ADHD so much. They may also have low moods, like they may feel very sad, they burst into tears, or they're constantly complaining, they feel depressed, and they may think of death and suicide. A child may fluctuate closer to one pole or the other, so they may be more depressive or more manic. 80% of children with bipolar disorder do have ADHD, but they may also have conditions like oppositional defiance disorder. They may have substance abuse, which is drugs and alcohol, and they may have severe anxiety disorders like OCD. Washburn made a list of key characteristics of childhood bipolar disorder. He felt that those children who needed less sleep, so they slept late, yet they were not tired and they woke up very early. They had unstable self-esteem and grandiosity. So at one time they would feel very down and depressed about themselves. At other times they were grandiose. They felt they could do things which average kids their age would not be able to do. They may be hypersexual. That means they show inappropriate interest in sex for their age or even inappropriate behaviors. I've had 6-7-year-old kids who would pinch bottoms or pull down the pants of another girl in the class. They may have elated mood, so they sing, dance and act goofy. They have racing thoughts. It's like motor mouth. They can't stop talking and they have so many ideas at once. They may have goal-directed activities. So there are times when these kids do very well in the classroom. They do all the work they're given, and at other times they just laze off. It's important to remember that stimulant medications and SSRIs for anxiety and ADHD are not given without the treatment for childhood bipolar disorder. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.